The CDC is relaxing COVID-19 rules and asking all of us to take personal responsibility for our own health. Medical reporter Liz Bonus shares some of what's changing.
Hey there, everybody. This updated guidance said to be a reflection that while the pandemic is not over, the CDC does want to get us to a place where it doesn't disrupt our everyday lives as much as it has these past 2 years. One big change, instead of separate guidance for those with up-to-date vaccinations compared to those who are not up-to-date, both are now the same. It's a reminder that because the virus keeps changing, either way you can get infected.
I think we're going to be living with COVID in some form or another forever.
So that said, if you are exposed to COVID-19, it's now suggested for 10 days you watch for symptoms and wear a mask. Take a test at 5 days if you have no symptoms, or sooner if you do. If you do test positive, you can end isolation on day 6, and you should still wear a mask through day 10 if you are without symptoms. But reflecting the rebound COVID, it's now suggested at day 5 if symptoms are worse, they want you to restart isolation again at day 0.
The key thing is to get people vaccinated and immune so that they don't get sick from it, and eventually it'll be a bad cold.
CDC has ended test to stay for schools. They don't recommend general testing now for people with no symptoms. They've also emphasized personal responsibility. Check out the CDC's list of conditions for serious illness risk, and check your community levels to decide what actions you should take to protect yourself. By the way, they say social distancing, just one way to protect against this virus, not a given. You won't get COVID if you stay away from others. In other words, they want us to consider the risk in a specific setting, meaning what's the ventilation, what's the community spread where you live, who is with you, and then decide if distance is a COVID game changer. I'm medical reporter Liz Bonus. Now back to you.